Dizziness is an impairment in the spatial perception and stability. Because the term dizziness is a very broad term and can have many different meanings, I try to distinguish the patient's symptoms as vertigo, or fainting, or pre-syncope, or disequilibrium. True vertigo is a sensation of spinning or having one's surroundings spin around them. Many people find vertigo very disturbing and often report associated nausea and vomiting. Disequilibrium is a sensation of being off balance and is most often characterized by frequent falls, sometimes in a specific direction. This condition is not associated with nausea or vomiting. Lightheadedness, weakness, or a feeling like you're gonna pass out or faint, we refer to this as pre-syncope. The symptoms of vertigo is a sensation of spinning while being still. Recurrent episodes in those with vertigo are very common and frequently impair their quality of life. Depending on the length, frequency, and associated symptoms with dizziness, we can determine the likely cause of vertigo. Although vertigo or dizziness can occur in many people at any age, it is very common among the older adults. A fear of dizziness can cause the older adults to limit their physical and social activities. These vertigo attacks can also lead to falls or other injuries. There are generally two causes or two types of vertigo. Peripheral vertigo, which is mostly related to the inner ear, and then there are central causes, which is mostly related to the balance centers of your brain. One of the most common causes of peripheral vertigo is benign positional vertigo. In this case, there are tiny crystals in the inner ear that interfere with the signal from your ear to your brain. Its symptoms are repeated episodes of positional vertigo, that is, of a spinning sensation caused by changes in the position of your head. Some patients are even able to tell the exact head movement that triggers the vertigo. Some medications can cause vertigo. We call these medications ototoxic medication. These meds often are designed to treat other disease process, but as a side effect, hurts the inner ear and can cause vertigo. The damage can be permanent or sometimes temporary. Long-term use or high doses of certain antibiotics or chemotherapy drugs can cause permanent ototoxicity. Other causes of vertigo can be an infection or some sort of inflammatory process of the inner ear or the nerve of balance. In this case, the patient can experience hearing loss, ringing in the ear, which we call tinnitus, or rapid and funny eye movements that we call nystagmus. Vertigo is diagnosed by the patient's history and often performing simple in-office clinical exams, such as the Dix-Hallpike maneuver. That is simply a roll test that we perform in the clinic. The treatment options for benign positional vertigo is very similar to the way we make the diagnosis. It's a canal repositioning procedure that is performed by laying the patient on the exam table and slowly moving them in a specific position to help the patient rid themselves of the vertigo attacks. Other treatment option involves an exercise maneuver that the patient completes at home on a regular basis. This is extremely helpful for the patients. If the causes of vertigo is due to a bacterial infection, then a course of antibiotics and close monitoring is needed. If it's an inflammatory cause, then a short course of anti-inflammatory medications or steroids may be needed. Once you discover the exact cause of vertigo, you can start the patient on a treatment course, which usually consists of vestibular rehabilitation exercises, which is supervised by a physical therapist. The exercises that compensate for decreased function of vestibular structures are simple procedures or movements that retrain the central nervous system and the balance centers of your brain. For example, you may focus on an object and then move your head from side to side, or walk backward and forth while turning or nodding your head. Once a physical therapist gets you started, you should continue these exercises at home. Here at North Oaks, we have a dedicated physical therapist that specializes in vestibular physical therapy that helps our patients with their vertigo attacks.